So what has transpired, as I mentioned, is that there has been a directive that for almost all of the PEPFAR USAID programs, not just at WITS, but across the country, they've been issued with the stop work orders, which means they need to cease all activity related to what the grant was funding. Now, I think it's important to clarify that doesn't necessarily mean that people won't have access to treatment. Certainly, people living with HIV should still be able to access treatment through government facilities. But the government facilities are going to come under more pressure because you're removing a whole number of staff that were otherwise being funded by the grants that were sort of supplementing the personnel in those government facilities.
Yes, Dad. Ricky, Ronnie. Hoeveel is hij? Die kan maintain.
Da, acolo to defend the cause and meet the challenges of transgender people. The beneficiaries that will be affected most by the pause of this funding is the transgender community as well as the sex worker population, but and overall the LGBTIQ plus, the Rainbow Nation of South Africa will be mostly affected.
An organization that follows us as actually I can't because
So the dispensation of this services are now being redirected at government, of which it is a great influx of people going back to the primary healthcare facilities, of which at this very moment in time they do not provide the tailored services to the transgender community as well as the sex worker population. So we hope that with the Department of Health we will be able to have this discussion and say that the gender affirming healthcare will also be available, because this is the same services that trans individuals has been receiving at these facilities.
I've been coming to this clinic for years now. I think it's been 8 years or something that I've been under their care. And now with Trump's ridiculous policies, that is all going to change. That is why I came here today, because they're closing for the next 90 days. It's ridiculous and it's quite scary because it all revolves around money, and money has been put first for a long time, but I feel like now when it's affecting our health, it's very important that we need to, I don't know, do something about it. We need to start getting angry and start revolting, because the only time things change is if there's a rebellion of some sort.
So was it expected or not? I think the short answer to that is it was expected, but I think the speed at which it has occurred has caught people off guard. Based on what President Trump was saying during the course of his election hearing, is that they had indicated that they were going to target programs that had components of diversity, equity, and inclusion. And many of the programs which have been stopped and which I fear will be cancelled completely are programs that sort of speaks around issues around DEI, diversity, equity, and inclusion, including LGBTQ plus issues. But government, I think, at the end of the day would need to step up and sort of fill the gap. They themselves might need to go out to other donors to see if other donors are willing to assist. And if not, then the Minister of Health will need to engage with Treasury to see what sort of funds can be provided to fill this gap until we got some stability.